On May 18, 2022, the State Minister for Teso Affairs in the Prime Minister's office, Dr. Clement Ongalo Obote, handed over a 600 million check to Soroti Regional Referral Hospital management to procure the much-needed X-ray machine for the hospital. However, the procurement process was met with challenges and the machine delivered early this year was commissioned this week, relieving patients from accessing X-ray services outside the hospital.
You don't have to use the darkroom to process images. When you work on the patient, we process immediately and the patient goes away with their film. So this one makes the waiting time short. The patient doesn't have to delay. Also, as the workers, it eases our work. This machine also enables work on a number of patients. Since the working time is shorter, it means we can accommodate a bigger number of patients. So this machine can work up to 30 patients per day.
While the arrival of the new X-ray machine is a welcome development, the medical professionals say it's just a drop in the bucket, considering the overall challenges facing the hospital. Issues such as inadequate infrastructure, staff shortages and limited resources continue to plague the facility, hindering its ability to provide quality health care to the locals.
The X-ray services will be free of charges to the client in line with government policy of service provision in public institutions. As we commission this machine, let us acquaint ourselves with some of the key challenges that the hospital is facing. One, there is inadequate infrastructure to match increasing mandate. We lack a medical ward, we lack accident and emergency unit. The wards are small, they are old, and they are associated with high cost of maintenance. This hospital has not received capital development funds for the last 8 years, and therefore needs an affirmative action to address this.
The hospital medical superintendent, Dr. Benedicto Watman, says that even after receiving the X-ray machine, the radiography department is highly understaffed, with only 2 personnel managing the whole department.
The nurses are very few, the midwives are very few. We also need more specialists and other critical staffs like anesthetists. Even where we have been, there are few. We have only 2 radiographers. As a hospital, we have made efforts to recruit some, but a number of them declined to take up posting to Soroti.
The hospital serves a large catchment area of over 15 districts, making its functionality very vital to the health and the well-being of thousands of Ugandans. The doctor's plea highlights the urgent need for immediate intervention from government to improve the hospital's infrastructure, staffing levels and overall capacity.
The staffing level in this hospital is only at 23%. 23%. What miracle do you expect the director of the hospital to do? That means we have a staffing gap of over 70% in this hospital. You go to our wards, we have people who are lying on the floor. After 40 years of NRA, this should not happen now. Honestly, no.
There is hope that the arrival of the new X-ray machine will act as a catalyst for broader improvements and renewed commitment to provide quality health care in the region.
In the next 5 years, we are going to work on Soroti Hospital. I can assure you that.
Soroti Regional Referral Hospital is poised to be an example of what the country's healthcare system should be, given sufficient resources allocated to address the urgent needs of the facility. Dire consequences for the health and well-being of the community it serves awaits.